Dear friend, there are so many different types of masks out there. Can you share more information about masks I've seen other people wearing? Which one would be good for me?
When we look closely with a microscope, we see that cloth face masks have small gaps that let some particles of the coronavirus to pass through. To reduce particle entry, use a cotton material or blend as recommended by the CDC. Also, the greater the thread count, the better. Finally, make sure it is multi-layered and fits on your face well for best protection. And don't forget, wash it after every use and do not share. Treat your mask like your toothbrush.
It is true that the various layers of the N95 mask can readily improve its performance and efficiency in protecting against viruses. But most of the exhalation valves do not have a filter built, and the air you exhaled will be released to other people around you. High temperature as well as humidity can decrease the filtration efficiency of the N95 mask. Not to mention, facial movements can break the seal and cause germ transmission.
N95 masks are not for everyone. People with medical respiratory conditions are not recommended to wear this mask as it would make it harder for them to breathe. They are also not designed to be for children or people with facial hair, because facial hair may interfere with the mask and it will not form a tight seal. We do not recommend the N95 mask to the general public. They are meant to be for healthcare workers and other medical first responders. But if you decide to wear the N95 mask, it is recommended to follow the instructions on the packaging in order to wear them properly. If used without reading the instructions, they may not fit comfortably to the face and could cause skin damage. Another alternative to the N95 would be the most commonly used mask today, the surgical mask.
Surgical masks are generally used by surgeons to stop the spread of their own germs to the patient while performing surgery. They also work well for sick patients to minimize the spread of disease through tiny particles that are coughed out. Surgical masks are medical grade certified and disposable, so if you're someone who doesn't want to wash your face masks in between uses, they are a great option for you. These masks are not meant to be reused, but many people are because of the shortage of masks. If you must reuse your mask, it is important to remember they should only be reused by the same person, and in between uses, it should be stored in a breathable container such as a paper bag. Keep in mind, about 20% of people infected with COVID-19 are asymptomatic or feel no symptoms at all of the virus. But even though they don't experience symptoms, they can still spread the virus just to someone who is having symptoms. Because of this, surgical mask is definitely a viable option for everyday use.
However, using surgical masks does come with some major drawbacks. For one, assuming that the surgical masks are properly disposed of after every use, the use of surgical masks may become more expensive than the use of N95s and homemade masks. Also, surgical masks are not perfect, and even at their best quality, they will not be able to fully protect you.
We hope that this has helped you choose the right mask for your needs. And please remember that mask wearing must be done with social distancing to best prevent transmission of COVID-19.